Interstitial lung diseases are very problematic, and a diverse group of greater than 200 inflammatory and fibrotic lung disorders associated with substantial morbidity and mortality. Many of these diseases are known to evolve from an initial inflammatory process, in turn causing obstructive sleep apnea. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about the occurrence of obstructive sleep apnea in patients with respiratory disorders. Obstructive sleep apnea is commonly found in interstitial lung disorders, with overall incidence varying from 17 to 88%. The morbidity and mortality of this condition are high when it occurs with chronic respiratory diseases like interstitial lung disease itself. Now, there is a lack of data on sleep-breathing disorders in such conditions, and specifically all this data is lacking in India. The present study in the Journal of the Associations of Physicians of India, it aimed to assess the occurrence of this obstructive sleep apnea in interstitial lung disease patients and also study its correlation with various other parameters. The study was a prospective observational study of 41 interstitial lung disease patients of the duration of 1 year. All patients underwent detailed clinical examinations, radiological investigations, lab investigations, and also type 1 diagnostic polysomnography according to the American Academy of Sleep Medicine guidelines. The severity of the obstructive sleep apnea was defined as per the apnea-hypopnea index, and the correlation of obstructive sleep apnea with other parameters, as I previously mentioned, were all assessed. It was found that dyspnea and cough were the most common symptoms. The most common type of interstitial lung disorder was hypersensitivity pneumonitis, accounting for 46.3%. The common findings were they had ground glass opacities and fibrosis. The obstructive sleep apnea was seen in 78% of these patients. The apnea-hypopnea index showed significant positive correlation with body mass index and the oxygen desaturation index. Hence, it was said that the prevalence of obstructive sleep apnea is common in North Indian interstitial lung disease patients. It was therefore concluded that the polysomnography should be done in all the patients with interstitial lung diseases, wherever it is feasible for an early diagnosis as well as for treatment of obstructive sleep apnea, as the coexisting of both will further decrease the quality of life and also increase the morbidity in this chronic progressive lung disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.